What's going on, everyone? Happy Tuesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Tuesday edition of the Pandemic Update for Tuesday, May 14th, 2024. If you're new to my channel, this is where we do the daily Pandemic Update on all things COVID and anything else that could be a health threat to you. COVID, influenza, hepatitis, measles. We're actually going to talk about hepatitis today. Climate change. Yes, climate change can affect your health as well. We've been talking about air qualities lately because wildfire smoke has started up once again in many different areas. If we breathe in bad air, that affects your health. COVID. COVID is still a major pandemic. It has not ended. I don't care what anyone says. COVID is still a thing, and we do talk about that. Want to stay safe from all this? Subscribe to my channel down below. Give this a thumbs up if you like the content. The more thumbs up we get on these videos, the more YouTube pushes out the content. It really does work. Let's try for between 100 and 125 likes today. And of course, share this with anyone you know and leave a comment down below. Alrighty, we do have a few news stories to talk about today. We're mainly just going to read a headline. We do have something on that CDC dashboard for influenza that was supposed to come, and it is finally out. And then we'll take a look at air quality data, our daily data, and also we're going to go deeper into Walgreens today. We'll take a look at a few states, some wastewater, and some of our other daily stuff. Starting off, just going to read a headline here and a little tidbit from it. TB, COVID, tuberculosis, COVID co-infections increasingly common, tied to worse outcomes, data shows. Let's scroll down here. I want you to see this. Hospitalized patients face 11% risk of death. Patients with both infections were at an increased risk for hospitalization, intensive care unit admission, and death. The estimated fatality rate among hospitalized patients with TB and COVID co-infection was 11.4%. Wow, that is not good to read. And then we go over to this. Patients with neurological disease are likelier to die after COVID find study. So if you know anyone who has a long-term neurological disease, anyone who's immunocompromised as well, we shouldn't just only mention that group. Anyone, really. They need to be especially careful. They really need to be masking. No indoor dining, none of that business. I mean, everyone at this point should not be doing any of those things just because, as we know, this is really this disease. It can cause so many issues, even for healthy people. COVID can cause issues. All right, moving on. This is relatively concerning. This has to do with the UK. Guardian. Nurses are quitting after COVID. This is coming from The Guardian. It's the name of a news outlet. And it says here, so much death and upset, the nurses quitting the NHS after COVID. A photo essay. That's basically what this story is about. You can see here, there's nurses in the pictures. And we go down to various different stories. And a lot of the stories state that they are dealing with burnout. They just can't do it anymore. And they have left the nursing profession. This is a real problem. It's not just happening in the UK. It's happening all around the country. I know personally people who have left the nursing, taken early return because they just could not do it anymore. The pandemic was just too much for them. I mean, and the seeing death constantly occurring, constant overcrowding of emergency rooms. I mean, when I listen to dispatch, I cannot tell you how many times locally I will hear them say, such and such hospital is on divert, such and such hospital is on divert. It's ridiculous. And it's not always because of an active COVID infection. No. A lot of people go on to develop post-COVID issues known as long COVID. And a lot of times you need EMS. I mean, these issues, they cause problems. You'll see in the EMS calls in just a little bit. All right, taking a look at this. LA County investigating a hepatitis outbreak among the homeless. This is not a good thing, and it looks to be that several people have tested positive for hepatitis A. There's not much details about this, but if you want to read the full story, I did tweet this out. Alrighty, moving on to influenza A now, in relation to H5N1. This is from BNO News. I thought I would read this to you. It's the easiest way to show it. CDC has released a dashboard for influenza A in wastewater to look for possible warning signs of H5N1 bird flu. The current data does not show the subtype of influenza A and can't distinguish between human and animal waste or byproducts. Okay, the distinguishing between human and animal waste, that I understand. What I don't understand is, take a look at this. Sites reporting high levels of influenza A virus can be investigated to better understand what's happening. Currently, 3 sites in 3 states meet those criteria. But then when you click on the wastewater site, watch, I want to show you something. Look, I'm trying to click on the watersheds. You know how with COVID, we click on the different wastewater sites, we can see the levels going up or down? You can't even do that here. So the CDC, what they did here was, they're really in a scramble, is my assumption. They want to get something together. Well, they threw this together really quickly. And by the way, let's just zoom this out for a second. Dark green, that's minimal sites, and then you have a lighter green, then you have these purplish pink. You have a pink, then a purple color, I guess we'll call it, to see these high levels here, which in Kansas is seeing some high levels. But again, you cannot click on an individual site and see a chart. When I go over to the CDC site for COVID, that's not the one we want. Here's the CDC site for COVID. Let me show you this real quickly. We zoom in here. We do this every Sunday. We do this multiple times. We're just going to randomly click on it. Say, okay, we'll come up here to Chicago, Illinois, and of course it's being cut off on the side. But you get the point. You can see a chart here. We'll just go to Elkhart, Indiana, and take a look at that. You can see the chart here, what's trends. You cannot do that with the new CDC influenza site, which is totally ridiculous. Maybe it's because the data is so new, they just started tracking. Down the line, they'll add something. I don't know. I think they need to do better, and there's a lot of people saying they really just threw this together as if they were in a scramble to get something together. Taking a look at the pollen levels for today. And today's pollen levels show 28% of the country is in medium status, and then you, of course, you do have some areas that are in high levels. Portions of Oklahoma, portions of Kansas, Nebraska, northern plains, upper Midwest. And then when you go down to the Boston area, we are seeing some indications that you are in high levels of pollen today. Now taking a look at what is going on with the pollen levels, and looking at the pollen levels, not pollen levels, air quality levels. We just looked at the pollen levels. This is air quality, and it's not good. The Central Plains, you can see right on up from Texas all the way up to the Dakotas, is in the yellows and oranges. A lot of oranges. That continues eastward along Interstate 80 over through to Chicago and into Detroit, and then there's a lot of yellow southeast of that. So there's a lot of places where you should be mindful, and you should have your HEPA air purifiers running. Make sure you're checking those filters to make sure they're clean, because when you are going through these times of bad air quality, such as here in the plains, your filter, it's going to get dirty much faster. Alright, moving on to this now. This is climate related. I have to show you this because our warming climate does lead to heat related illnesses, and pretty soon I'm going to be adding that heat related illness dashboard, probably within the next week or so. I'm putting that back into our updates. April 2024 was the Earth's 11th consecutive warmest month on record. That's not a good thing. Want to learn more about climate change? I got another Twitter account where I do just that. It's at Climate Data Report. Climate Data, capital RPT, or just search Climate Data Report in the search bar and it should come up. Philadelphia yesterday, 790 EMS incidents were reported. Taking a live look at Montgomery County. Montgomery County is not too busy right now. However, we have to look at Chester County. Before we can look at Chester County, here's just a few moments before we start recording. I wanted to make sure I tweet this out and have a screenshot of this to show you what it was like just a little bit ago. And you're going to see a theme here. There were several sick person calls. There were 5 at once. Then there were heart problems, respiratory difficulty, multiple cardiac arrests at once. That's not good. Well, let's go live looking with Chester County. All right, a little better, but still, again, sometimes I say it's a type of calls. Unresponsive person, heart problem, sick person, stroke, heart problem, sick person, stroke again, respiratory difficulty, unconscious person, and respiratory difficulty. So, not a good set of calls over the last couple hours in Chester County, Pennsylvania. Taking a look at the Walgreens COVID positivity index. Current week is 15.3%. The prior week was 14%. The difference of up 1.4%. Testing is down, and they're not doing much testing at all. Total test 3,565. The prior week was 3,763. Now let's take a look at a few states. I say let's do 5 states. No, let's do 6 states. Make it an even number. And let's start off with New Jersey. Why New Jersey? Well, New Jersey's actually seen a legitimate rise. The positivity rate was 13% this week and was 8.5% last week. That's up 8.5%. Total test, it's also up. 131 versus 118. Very small number of testing. And I know I constantly, when we do Walgreens reports, I get comments down below from people who find my channel saying, really, you're dissecting that many tests? Yes, I am dissecting that many tests. Because when there's 131 tests, versus 118 last week, and positivity rate still went up, it shows that even with that small amount of testing, there is somewhat of an increase in potential cases in that area. All right, moving on now, let's take a look at Ohio. What's going on there? Now, Ohio, they're up for the positivity rate, but it's a different story. 20.4% the current week versus 14.5% last week, difference of up 5.9%. However, in this case, testing is down. 54 versus 62. It's somewhat of testing related. It could probably be a combination of testing and maybe cases, but again, when testing is down and positivity rate is up, we lean more towards it being a testing issue. Let's go down to Florida and see what's going on there. This is our 3rd state now. Take a look at Florida. 14.8% this week. The prior week was 14.1%. Difference of up 0.7%. Testing is down here in Florida. 568 versus 575. Let's go over to Texas now. Texas is reporting 13.6% positivity rate this week. The prior week was 12.5%. That's a difference of up 1.1%. Testing is down slightly. 645 versus 662. And I do want to show you something. That's Texas doing 645 tests. So Texas and going back to Florida, hey, just those 2 states alone, that's over 1,000 tests, and we only did 3,500 tests in the country. Now let's take a look at California, where we do have some good news here. 15.4% positivity rate is the rate for this week. 17.7% COVID positivity last week. That's down 2.3%. Total tests, 182 versus 158. So testing went up, positivity dropped. That is a good thing. And let's look at one more state. Let's go up to Washington. I promise we will do some more states again tomorrow. In Washington, they are seeing 18.5% positivity rate. 17.5% was the prior week's rate. That's up 1.1%, but testing was down. So it's 54 tests versus 63. All right, moving on now. Let's take a look at BioBot real quickly. And we do know for BioBot, national level, there is a small increase now ongoing for COVID. The Northeast dropped a little bit after a brief rise last week. The West is rising slightly. The Midwest is dropping slightly. And the South is rising slightly. Let's go to Wastewater scan. Let's just do 2 sites here, then we're going to move on. Taking a look at Washington, D.C., if we can. Washington, D.C. at this time is seeing a rise for COVID. They're not seeing a rise for RSV. Look at influenza A. That is seeing a rise, as is influenza B. Rather strange to see that happening here in the middle of May. That's not a good thing. No Mpox detections. Norovirus is dropping. HMPV is dropping. And when we take a look at hepatitis A, there have been some detections of that at this time. And I say we should do another wastewater site. And this time, you know what? Let's go up to Utah. What's going on in Salt Lake City? I want to know. So in Salt Lake City, Utah, they're seeing COVID is relatively flat. It's just an ever so slight rise. RSV is low. Influenza A and influenza B, not much of a problem. I know they're saying medium for some of these levels. It's low. Taking a look at HMPV, not terrible. Norovirus could use some work. It's starting to rise once again. It's saying high. It's a minimal. It is at the moderate level at this time. No mpox detections, and hepatitis A does have a few detections at this time. Taking a look at what is going on with COVID epidemic status, it is growing in some states. It's growing in New York, it's growing in New Mexico, and it's growing in Oregon. It's also likely growing in the state of California, Nevada, Arizona, Colorado, Wisconsin, Maine, and New Jersey, and by the way, it is also growing in Hawaii. And then we see that it is declining, or likely declining in some states, and there's many states that are stable or uncertain, or just not estimated at all. Taking a look at variant proportions, and we do see the KP.2 variant leads the way at 28.2%, and the old JN.1 variant, which caused the winter surge, is at 15.7%. Taking a look at New Jersey for today, 158 hospitalizations. That's with 65 out of 70 hospitals reporting. 5 people on a ventilator. 18 people in the ICU, so that number in the ventilator actually went up a little bit. Discharges, 10 at this time. Speaking of going up, we got to talk about New York State now. 396 people have tested positive. That's not really rising at this point, but what did rise ever so slightly was the number of people in the hospital. It was 443 yesterday. Today it is at 444, but the ICU number did go up by 13, or no, excuse me, it went up by 10 to 41. So there was an increase in the number of people in the ICU. I suspect that number will drop again tomorrow, and we're not really seeing much of a rise here, but they're not dropping anymore either. I would like to have seen them get below 400. They did not do that in New York State, so they're probably going to bounce around at these levels for quite some time. Alrighty, folks, that does it for the Tuesday edition of the Pandemic Update. We'll have another edition of the Pandemic Update again tomorrow with any news that comes along and anything else that we find to report on. If you learned anything or you're new to the channel, please consider subscribing down below. Give this a thumbs up. Again, let's try for 100 to 125 thumbs up today to help this push itself out through the algorithm. And of course, share this with anyone you know. And if you have any comments on anything you saw today, maybe I got something wrong, or maybe you learned something, or maybe there's something you just want to say, leave that comment down below. I will see you all again next time. Until I see you again next time, stay safe, everyone. Have a fantastic Tuesday evening, and thanks for watching.